Hi, on this video, I really want to talk to some people, those of you that are in the medical profession, because that is the background from which I come from when we start using electrotherapy. And I want to explain to you different medical professions and how the Infrex system works within what you're already doing, and also sort of incentivize you to learn more applications because the results can be outstanding. And using the Infrex as a complementary therapy to some of the things you're already doing has positive social impacts, especially from the financial side, for our whole healthcare system here in the United States. And specifically, I'm going to take a couple of you, like those of you that are physical therapists. One of the things you have to encounter in physical therapy is, and my wife is a physical therapist, I will tell you, but you end up in situations where, unfortunately, pain is gain. And many times when you're trying to get a patient do the things they don't want to do because it's painful, then they dread going to PT. So what's one of the things you can do? Well, our Infrex Actual Plus unit, one of the nice things that's happening now is, and I've seen it in the orthopedic world, for those of you that are orthopedic physicians or work in orthopedic clinic offices, it's almost becoming standard. Once a patient has had surgery, they immediately put a TENS unit on them. Now, there's a couple of reasons for putting a TENS unit on. Number one is to help reduce the pain, but number two is to accelerate the healing, so that if you can heal quicker, you can get to rehab quicker. That's why the Infrex Plus, the reason we have the TENS side, the TENS mode, is specifically for that. But immediately upon healing, and now we start the destructive, reconstructive process of rehabilitation, we can flip it over to the interferential mode. The reason we use interferential is when that patient comes to see you and you want them to do certain exercises that are painful, do it in conjunction with using interferential. The patient will find out that they can increase the power once you've got the unit on them, and they can actually extend range of motion, and so doing that shorten the rehab time. The pain is lessened because we override it using electrotherapy. Now, the other thing, and some of you may have seen the video of my daughter who blew her ACL out, or lateral meniscus on her knee, just blew it out 2 days before she started her senior year in high school. When she would go through the very aggressive rehab, she came back in 98 days following ACL reconstructive surgery. But even to this day, as she's now in college, sometimes she goes through some really rough conditioning at the college level, and she'll say, "Dad, I want my Infrex Plus, so when I come home, she straps it on," and she may take the treatment for 30 minutes, an hour. And what she's trying to do is lessen the pain, the tissue damage that was done. She wants to get it repaired quicker because she's got conditioning the next day. So she's trying to enhance her overall performance. That's a situation, not only for physical therapists, but especially for athletic trainers. When you see the patient that is going through rough times, including injury, high ankle strains, hip pointers, what can you do to incorporate this into your practice? This is another thing that helps. Other ones, rehabilitation clinics. You bring a patient in that you're trying to regain range of motion, hoping to prevent frozen shoulders. What can you do to help that patient? Well, as you stretch and bend and tear, and this is also for naprapaths. Now notice, I'm not saying natriopaths, I'm saying naprapaths. Those are the people, the doctors that specialize in connective tissue disorders. When we are doing these range of motions, overcome the pain first. As soon as you finish doing it, let them use a unit to take, because you know they're going to have more pain. They're going to have more pain because you extended range of motion. You basically tore so that it can rebuild, so you can tear again and increase the elasticity, which results in the greater range of motion and prevents the frozen shoulder and replicating everything you'd already done, plus a great deal more pain. That's another area. We have an area also where we use and is functional electrical stimulation. But if you have a clinic that deals with multiple sclerosis patients, when you read Dr. Terry Wahl's book, Minding My Mitochondria, you will see the very heavy involvement of nutrition and functional electrical stimulation. What we're doing there is we know the functional electrical stimulation along with the volitional exercising, put them together, and we might be able to retard the progression of multiple sclerosis. Dr. Terry Wahl certainly has, and she has many people following her now in diet and functional electrical stimulation. These are the things that we're trying to bring to the table. For those of you in the healthcare field, we want to help you shorten your treatment time, improve your patient outcomes. Many of you, especially in the medical world, may not need more referrals, but many of you will. And the best basis for referral is positive outcomes for former patients that spread word of mouth. That's the type of things we're looking for. That's why we hope to be able to work with you on the medical side and enhance your overall performance by working with the Infrex system. Thanks for watching the video.
At MedFacts, our priority is to educate and inform on topics such as pain relief, sports performance, injury rehab, nutrition, antioxidants, electron supplementation, and electrotherapy. We carry a complete line of electrotherapy devices and accessories, including interferential, TENS, ultrasound, muscle stimulators, electrodes, and more. We are excited about being on the cutting edge of electrotherapy research.